Bon matin, bon après-midi, good morning, and good afternoon to all our TPA partners that have graciously registered and accepted to participate in this event today. I'm glad to see you join us, and this is obviously the TELUS Health Virtual Pharmacy webinar that we have scheduled, and most of you who have attended the Adjudicare Partner event in June of this year have been made aware of TELUS' most recent acquisition of Alliance Pharmacy. With this acquisition, as we noted during the partner event, is TELUS has broadened its reach, including its offering in the virtual pharmacy space, providing greater access, including supporting your clients' cost-saving initiatives, while providing a better pharmacy experience and improve access to care for plan members. With that in mind, we hope this presentation will provide greater insight post the partner event, which at such time it was kept at a more high level, as TELUS continued at such time to focus on its rollout approach, improvements to our offering, etc. So let me introduce Jason. Jason Kennedy is a licensed pharmacist in the province of Ontario and received his pharmacy degree to be specific, in 2004 from the University of Alberta. He joined TELUS Health in 2009 as a clinical pharmacist, where he assisted in program and formulary creation and maintenance. Working with the formulary team at TELUS Health, Jason participated in new drug and clinical review activities. In 2010, he moved into the sales team, where he worked closely with carriers to deliver strategic programs for plan sponsors. In 2014 onward, Jason moved into the role of Director of Operations, overseeing operations and client support for non-Quebec-based clients, moving into strategy and innovation. And finally, in April of this year, Jason assumed a new role as GM, so the General Manager overseeing TELUS Health Virtual Pharmacy, responsible for all of the overall business. Jason continues to practice pharmacy and now at the TELUS Health Virtual Pharmacy, as part of TELUS Health Virtual Pharmacy. So Jason, I'll pass it on to you to proceed to the presentation.
So I'm really happy to be with you here today, hopefully with fewer technical difficulties from here on, just to share a little bit about where we are now as Alliance Pharmacy, and then turning into TELUS Health Virtual Pharmacy. The last number of months I've been talking about where we're going to be. Well, we're finally here, and I'm interested to talk about what here means, but also where we're looking to go next. And so, I think it's important, just as a bit of a level set, that you understand that TELUS acquired Alliance Pharmacy Group in February of this year. And Alliance is an established mail order pharmacy with a national footprint outside of Quebec, with a real history of sharing medications in a mail order fashion, coast to coast. And we saw this as an interesting asset addition to the TELUS Health ecosystem, because we could take the expertise and assets that are Alliance and that foundation in the form of automation and capacity, the ability to scale, and the knowledge on how to distribute in an efficient way, and really take the TELUS Health expertise and assets to kind of take the Alliance footprint and foundation and turn it into something that is a little more future facing. And what we're looking to do and have done here is taken some of the best ideas around digital capabilities and infused them with the foundation that is Alliance Pharmacy. And in doing so, we also bring this expertise and this commitment to health from the broader ecosystem that can also impart information and direction into our future and where we're looking to go from a roadmap perspective. So, from an HBM perspective, that's our PBM, Health Benefits Management. From an EMR perspective, from a virtual care perspective, we were able to bring those technologies to bear to really, take that foundation and turn it into something that really works well in a future-facing ecosystem. Next slide here. So, our current services that exist today, as I mentioned, we have 3 pharmacies, one in BC, one in Manitoba, one in Ontario, serving 9 provinces and 3 territories. We are going to be expanding to Quebec, Alberta, and New Brunswick in 2022 to give us complete national presence and, speed to certain areas such as New Brunswick, the Atlantic, and Alberta. And we are a full service pharmacy in that, we've seen a lot of growth in the last year, but really able to provide acute maintenance and specialty meds to all patients. If you saw this slide back in April, May, we had, I think it was 46,000 lives or active patients. So this here at 61 shows kind of the growth we've seen in 2021, in part due to the acceleration of COVID and people getting more comfortable with the idea of receiving care virtually. Some other things that we offer as kind of standard as part of the kind of comprehensive package here is next business day delivery and no extra charge. That's covered by us. A 90-day fill rate in terms of, where possible, we like to fill for longer fill times to reduce our shipping costs, but that also turns into reducing dispense fees for patients and plan sponsors. And from an adherence point of view, we offer our med packs to help people who have issues kind of remembering and organizing their medications. And then, as I mentioned, we have the automation and scale capabilities to kind of get through the growth we've had this year, but also the growth we're expecting in this area. And, I think part of all this is the underpinning preferred provider network offering that we can provide to plan sponsors and TPAs and carriers and payers, really, that allow for cost savings and reduced dispense fees. So, that's our current services. But really what I'm happy to do today is really introduce, what we've been working on and brought to market 4 weeks ago. And that's, TELUS Health Virtual Pharmacy. It launched in October here, and you can now see online at our website, teluspharmacy.com, our new portal, our new mobile app, as well as a refreshed experience, really, to help patients that are already on the platform get more out of their medications. So we're taking it less from the transactional element of mail order pharmacy, but really starting to infuse the kind of TELUS brand, the feel, but also a more intuitive user interface that allows patients to really control their medications and really, empower them to take control of their health. These are actual images of, our product suite as well as our pharmacy team. So this will give you an idea of, the look and feel of everything we've got here, up to our vials here on the left, our med pack, as well as our mobile app. And then up on the right, you see some of the pharmacists out of our Aurora facility there. That's actual staff that help, provide quality care day in, day out. And I think this is a really nice build here to show you the mobile app that we've recently launched, available on the App Store and Google Play. Really takes that mail order experience and centralizes it in a really intuitive fashion. So here, going from left to right, you see, the ability to create an account. Then as you go to building a profile, if you look down or at the bottom here, the ability to, right here, the ability to tell me about your medical conditions. Do you have diabetes, asthma, heart conditions? Put in your allergies, those sorts of things. Then what's next? Hey, you have medications elsewhere and you'd like them transferred. Well, tell me about that. Where are they? What pharmacy are they at? Are we going to transfer some of them or all of them? And do we want to fill them right now or wait till a later point in time? So again, really turning this into a very much self-serve, easy access experience. This one here is really nice. I'm using it with my dad right now, and it's the opportunity to add a family member with their consent. And for me, as part of that sandwich generation, I want to better understand what my dad is taking, but also making sure he is taking it. And so many seniors today, may not be technologically savvy, but perhaps their family member like myself might be a little more so. And for me, it gives me nice peace of mind because, previous to this, he had his medications in his wallet, which is fine, but only he has access to that. Now I have a better sense of this and I can help with his care and be a little more available in support of his care. So we think the family member function is actually a real differentiator out there and something really nice. And then here's an actual screen of, you're about to order your medications. We have the image of the medications and kind of the workflow there, as well as letting you know that the medication has been shipped. And this final piece is what really takes the care element into the great foundation that is Alliance, which is, the ability to build trust and speak with your pharmacist face to face. And, we can do that via call, we can do that via virtual visit, face-to-face visits. And we think that actually offers a lot of convenience to allow patients to take the time to learn about their medications and to hear about their medications. Because it's very often that when you go to a pharmacy, maybe you're not in the right frame of mind to receive the information, or you've just, had a really long day and come from a couple-hour wait at the doctor's office and you just want to go home, or you're having issues with your payment. So you're not really, taking in what the pharmacist is telling you about your therapy. So we think this is a real great way to both empower people to connect at a time that's convenient for them, but also help sort of build trust into the process that is virtual pharmacy, right? We don't just want to be mail order fulfillment. We want to have this care element that's delivered virtually. And we think this is one of the foundations in combination with some of our app features that will allow us to get there. If you look on the left here, I'm just showing 6 areas that we're really looking to make sure we do really well over time. Prescription convenience, pharmacist access, benefit navigation, virtual care and pharmacist virtual visits, as well as medication guidance and health and wellness. And what I would say here is, if you're going to be a pharmacy or a virtual pharmacy, these 2 boxes here are table stakes. You have to be able to do that. What we're looking to do is take the expertise and understanding from health benefit management team, the PBM, to really improve the benefit navigation piece in terms of prior authorization, step therapy, program design that helps communication with patients and members, and really looking to build that out over time. And then similarly, looking at other areas of our business in terms of virtual care to say, how do we take some of those best practices and some of that technology and create a more cohesive experience for the pharmacy client, whether it's a patient or a caregiver. And then building on top of all those is the idea of medication guidance and health and wellness to really round out the full pharmacy experience. So this is what we've delivered so far, which we've called our minimal lovable product, which is the app features I just showed you there. And it's really this idea that says, we think we've built something really great in the last 7 months, and we think we've got pretty close to feature parity out there, but we're not stopping there at all. And what we're looking to do in the future here, the fast future, is, build out a few other capabilities to really round out that experience. So the first one would be, and we're looking to do this for late Q4 here, virtual care redirect, which is the idea, if you're out of medications, the opportunity to go to My Care through our app and connect for the purposes of getting refills. And for those of you who don't know, My Care is part of the TELUS Health ecosystem, and it's a virtual care product for direct to consumer, and it's no charge to patients. It's actually paid for by the billing to the government. So again, the opportunity to redirect to allow patients continuity of care, refill their medications if they're out, and really, start to bridge that continuum of this digital experience. The other thing we're looking to build in 2022 is OTCs, both availability as well as recommendations, plan sponsor and advisor dashboards and portals to help take the information and the data that we're compiling here and working with the HBM team to make it meaningful, to kind of talk about potential savings, to talk about how this has benefited your plan design. And the other area we're looking to deploy into early next year is this communication layer with the HBM drug engine, which would facilitate better information sharing between the HBM ecosystem and our pharmacy for the purposes of transferring of medications. So to remove that step of, even having to list those medications at all, but actually being prompted to say, would you like, X, Y, and Z medication transferred? So, these are some of the near-term features we're looking to build in, but really what we're looking to do is round out that digital experience so that you and your plan sponsors and plan members benefit from the TELUS Health digital ecosystem experience, but also build out that care experience. And that's really where we're looking to go. So as I mentioned, the idea of enhancing the member care experience is core of what we're trying to do, and taking that foundation that is Alliance, but adding the ecosystem that is TELUS Health to really bring the best of both to bear. And to do that from a capabilities and expertise perspective so that we can actually begin to act as a therapeutic care guide. And in doing so, help patients and plan members live their healthiest lives. And using the pharmacy as a compelling lever to help reduce costs for plan sponsors and plan members. So we're really looking to index onto that care side, but also how do we be a meaningful cost lever for payers and plan sponsors. And so this is, the value proposition as we see it for plan members. And, I think some of this is table stakes to all pharmacies, but some of this is going to be really unique to us. The idea here of allowing, to be empowered through a virtual care experience is going to be really central to us. The idea of minimize waste through 90-day fills. So this is the idea that, because we're paying for the shipping, we actually think it's better to ship longer days supply because, obviously we pay less, but it saves plan sponsors and it saves plan members dispense fees versus the corner pharmacy where every time you go in, there's a chance you buy milk or you buy something else. Well, we're not looking to kind of, play in that area. And so we see the idea of longer fill times as a real value. And it's important also because it allows for better harmonization of medications. And what I mean by that is if you can build a foundation where patients are getting their medications at regular intervals, you can introduce, as patients get more and more medications, you can synchronize a lot easier. So when you start to synchronize, you build the foundation for better adherence and better compliance. And so we're really trying to set that foundation right from the beginning. And, what we're looking to do and eventually get all the way over here is, enable the pharmacist through information from virtual care, from HBM, to really, and the pharmacy information, to engage with patients to create meaningful interactions. And in doing so, really start to customize that care, whether it's a patient going through the prior authorization journey and how to navigate that. And because, we work with the HBM team, we have a better kind of sense on what that member journey looks like and the ability to help patients navigate that. Or whether it's in the future, working with virtual care and potentially sharing lab work to now, create a better care experience that's delivered from the physician perspective virtually, but also from the pharmacy perspective virtually. And for payers, what we really want to do is deepen members' relationships with their employers and with their carriers. And we see this as, an opportunity to create a compelling offering for staff that really meets them on their terms. And I think we saw this through COVID, which was this idea that patients got comfortable receiving care virtually. But also we're seeing this idea through everything in our lives, this immediacy effect and this idea of like, I want my information available to me when I want it. And that's what we think we provide through, our dashboard and our app. And doing this allows for, plan sponsors who offer us to their employees as part of a PPN, the ability for the patient to save money and the plan sponsor to save money, but also a solution that's kind of modern and current and is starting to meet the employees where they're looking to go. And, in doing so, we're hoping to really bring these innovative experiences, but also tangible savings. And into the future, what we're hoping to do, as I mentioned, starting, I think it's in June of next year, we're looking to build that first connective layer with the HBM team. And in doing that, it will, lay the blueprint for the ability to start using that connection for other information sharing that can help, reduce plan design friction, improve the sharing of information such that it's available to the patient at a time that's relevant to them. And so we're looking to do this in such a way that it allows us to reduce friction and allows plan sponsors, TPAs, payers alike to really, rethink how they want their programs to be enabled. Because today, one of the biggest blockers to enabling certain programs is the communication. And it totally makes sense. I mean, if you, put in a new program Jan 1, which, is coming up quickly, you do all this work in communicating it. But if a patient doesn't have a claim until September, they've forgotten all of that. So, that generates a call, that generates a question, there's a flurry of activity. It results in kind of like, some back and forth. We see the opportunity for HBM here to really help share information that can be pushed into our app experience that helps, further kind of amplify what the payers are doing in terms of their own communication strategies. And by reducing that friction, allowing us to be more comfortable with, effectively deploying programs. And from there, what we're hoping to do is learn from that to say, okay, now that we have a pharmacy and a PBM working together in a digital fashion, sharing information, are there other programs that we might want to deploy that we were not doing today? And so that's really where we're looking to go, is unlock a future of programs that are really optimized through the digital pharmacy here. So I think, a couple things I want to share with this audience here is, when we set out, we wanted to do these three elements on the left, I'm sorry. Create a meaningful lever to bend the cost curve. We want to help create flexibility of coverage for a changing workforce. And we want to enhance the members' care experience. And that's kind of the areas we really want to make sure we're doing really, really well. What was interesting as part of this process, and we've taken a completely different approach to this process than anything I've ever done in my time at TELUS, is we've actually sought opinions and feedback from the TELUS employee base. And so we have almost 35,000 employees at TELUS team members. And in June, we sent a survey to them, to 6,000 employees. And we heard back from 6,000 employees. We heard back from about 1,400 of them in less than a week, and said, the questions we asked were, if we were to add this as part of our benefit plan, what were some things that we need to do really well for you to be interested and for you to actually take advantage of that service? And so this is what we heard back, which here was, there has to be cost savings, and that has to come through markups and dispense fees, and a benefit and a cost, a tangible cost benefit to the patient and to our plan members and our TELUS team members. The other thing we heard loud and clear was the quality of service has to be solid. We have to do this really, really well, from a convenience around receiving the package to video consultation to how the app works. Has to be really, quality experience, something we can be proud of. And the final piece was ease of use. How easy is it to use these things? And so fast forward a number of months, and as I mentioned, we went live with our new experience just over 4 weeks ago now. And we said, you know what, let's go back to those same 6,000 and test what we've got. So we've registered, I think we asked for 500 volunteers to, download our app, take advantage of the pharmacy experience, test it out, but also provide us feedback. So we have, I forget what the exact number is, but a number of people, I think it's 25 users going through user-guided testing or moderated testing, which is we're on the phone obtaining feedback as they're going through the experience. And then the other cohort of, some X hundred TELUS team members going through, we're surveying them weekly. What do they like about the app? What don't they like about the experience? What could be done better from a pharmacy experience, delivery experience, all of these areas. And we're doing this until the end of December here, or first week of January. And really what we're doing this for is to kind of practice what we preach here. There's going to be no hiding from the feedback, good, bad, or other, but we really are looking to design something that we can be proud of. But also if there's feedback there that can make this solution better, we're looking to implement that as quick as possible so that, everyone benefits from this feedback and there's this constant continuous improvement to what we're doing. And so, we think we are able to deliver these. We're getting feedback now on what's working really well and to keep doing, and we're getting feedback on this is a little, there's a little bit of friction here, so can you improve that? So all of this is being kind of evaluated, and we'll have a good view of it shortly. But I think it's part of that commitment that we want to really, deliver something that's, effective for all, and our own TELUS community are really invested in seeing that happen. I think the last thing I would leave you with here, I'm available in the future, and we can have our team, if you have interest, going further in these conversations, working through Lucy's team to, learn more about our price files, potential savings, and implementation steps. But I would say, one of the advantages of really working with the HBM, the Health Benefit Management PBM side, is that, they already have the price files ready to go. They already know the implementation plan. So really, when it comes time for how do we turn this on, it's a much easier kind of conversation because we have experience working with that team. They know what they're doing in terms of our offering. And so at that point, it's really about communication. So I think, we're looking to make the whole process of selecting this really easy so that a lot of those decisions are taken away, and you can trust us to get it to the end and then work on the communication with us. And the final thing I would just say is, our app is available on the App Store and on Google Play. And here's some of our other links, teluspharmacy.com. I'd encourage you to check it out. Tell us what you think. And yeah, I look forward to hearing from you. So thanks for your time today, and I'm happy to answer any questions.
Okay, well, thank you, everyone. And this concludes today's webinar. And again, we'll connect very soon. Thank you so much.
Thank you.